Thank you everybody for joining us for our daily update. Today is Friday, March, is it what, 27th? Wow, time is moving along here. We do have a really packed program today in this daily update from the COVID-19 task force. And I'd like to get started immediately with Chief Peacekeeper Dwayne Zacharie. He's not going to be here long, but he has a couple of quick messages for you. I think they're pretty important. Dwayne?
Hello, Joe. Good afternoon, everybody. Thank you for being here this afternoon. Some of the messages that I wanted to impart to the community is that we're really pleased with the vast majority of people in the community, you know, taking the time to do the social distancing, taking the time to make sure that they're safe and secure, taking the time to make sure that the businesses are closed. You know, it's only supposed to be essential services at this point and essential businesses. But, you know, the reason I'm on today is I wanted to point out to certain people, certain individuals, and you know who you are, you're not respecting the essential services only or essential businesses. And we're receiving lots of complaints about it. And because of that, you know, we're going to be taking additional measures in terms of enforcement. We were trying to work really closely with people and hoping that people would comply, right? We wanted to practice community policing, but that seems like it's not really realistic at this point, given the conditions. So additional enforcement is going to be taken, and we just wanted to let people know, those who are following along, thank you very much. It's really nice weather out there. And we see that there are increases in people out and about in the community. Please continue to practice your social distancing. That's paramount. Stay safe, and for the most part, we're asking you to stay home. Yeah.
Thank you very much, Dwayne. Where to start? You know, it's been a long 2 weeks, and 2 weeks ago today, terms like social distancing, self-quarantine, you know, these words we maybe never even heard of or rarely used, but now it's part of our everyday language. You know, all our lives have changed in the past 2 weeks, and where we'll be in 2 weeks from now, no, we don't know. Only time will tell. It's a very fluid situation. New information comes out daily, and like I said before, sometimes hourly. And we have to be flexible as a community, resilient as a community, as well as the COVID task force. We're also equally resilient and flexible and take on whatever challenges come our way. No, despite all the efforts being taken in Kahnawake and also in Quebec, unfortunately, the numbers of people being affected by the virus continue to rise. Now, the next few weeks are going to be crucial. We don't know where that peak is going to go, how fast we're going to reach the peak before we start seeing those numbers dropping. So, with the measures taken in the past 2 weeks, like since the travel ban was implemented, you know, it's been 2 weeks since the non-essential businesses start closing their doors. When we start asking people, you know, to stay home, when social distancing became a reality, when all these measures start coming into effect. So it's been about 2 weeks now. And whether or not these measures are going to be successful depends on, you know, the compliance of individuals. Like Dwayne was here a minute ago talking about, you know, compliance and the enforcement aspect on things, but the day-to-day person, you know, on the street, respecting social distancing, washing your hands effectively, and doing your part, you know, as Kahnawake to ensure that you're protecting each other. You know, we're only as strong as our weakest link, and as stronger we are, again, the least amount of impact that we're going to have overall on our community. That is the goal, to protect the most vulnerable people in our community, but not only the most vulnerable, to protect everybody, because nobody's immune to this virus. Short of that population, our elders, our most treasured people, you know, are more vulnerable, but everybody's vulnerable to this disease. Nobody is immune. And I'm sure Dr. Gautier could elaborate on that and a little later on. Now, what we did to this point, you know, some people still consider to be, you know, drastic or extreme, but certainly if you look at the news internationally, locally, and across the province, no, they're certainly not extreme. The situation we've seen playing out in New York City is getting out of hand. Things are getting worse by the day, and we certainly don't want to see that happen in Kahnawake, or for that matter, within the area of Quebec around us. So these measures are taken for logical reasons, based upon scientific evidence, based upon people who know what they're talking about. No, the COVID task force relies on the scientific evidence, which we'll hear of in a few minutes, to guide us through this tough time. And I just want to touch on one last point before we have other speakers come up. And Dwayne touched on it already. People have been calling the peacekeepers, pointing out that certain individuals are not abiding by the directives. They've been speaking out on social media, demanding people do certain things, which, if done in a respectful manner, is fine. If somebody's not complying and people don't agree with it, call them out. Do your part. Keep it obviously, peaceful and such, but call them out. And that's how we're going to get through this as a community. It shouldn't be all just left on the shoulders of the peacekeepers saying, well, they're going to go there and enforce the law, which they'll do if they had left with no alternatives to do so. But no, it's more than just the COVID task force. It's more than just the peacekeepers. The community itself, the vast majority, overwhelming percentage of this community understands and wants people to abide by the directives, abide by whatever requirements are done. So it's not, you may have a small percentage of people who don't agree or want to look at their own personal interest over and above the collective interest of our community. Vast majority of people are abiding and understand the seriousness and severity of the situation that we're in. And not one person or two people have the right to jeopardize our entire community. So believe me, it's been a long week, 2 weeks. We're not going anywhere. The task force is meeting as required. I know a weekend is coming along. Everybody hopes to get a little bit of rest, but we're going to continue meeting as required. We're going to be available. We're going to be in the office. We're going to be on our cell phones. We're going to be available if the need arises. So with that said, I could thank, after these 2 weeks, thank the people in the community for their overwhelming support through text messages and Facebook messages and stating their appreciation for the work that the task force has been doing. So Nyawagoa, I thank you very much for that. Although we're not here for pats on the back, but certainly knowing that your community is behind you and supports you, it helps us get through this tough time, and we're making those tough decisions that we know our community is behind us. So with that, thank you very much, and I'll see you soon. Oniwahi.
Right now, Lloyd, and Lloyd made a good point. We've been bringing you these updates, and just a little addition to that, just because it's the weekend doesn't mean that they'll be stopping. We are here 7 days a week at this time until further notice, so we'll just keep doing what we do. Joining us next, we have a couple of people from the Zacharie Memorial Hospital Centre, and yesterday a momentous announcement, one that I was very proud of, that Kahnawake will be at the Zacharie Memorial Hospital Centre having its own COVID-19 testing facility, a testing site. That was something I wouldn't have guessed would have happened, and certainly 2 weeks ago, as Lloyd said, would we have seen something like that, even thought about it? It was inconceivable, but it's a fact. And here to talk about that and a couple of other things is the Executive Director of the Zacharie Memorial Hospital Centre and also the spokesperson for that wonderful institution, Lisa Westaway. Sorry.
Go ahead.
Hi, thanks. So I just want to give some details about the drive-through testing site. Yesterday, I had announced that we would be giving our first appointments on Saturday at 2 o'clock. Unfortunately, we were not able to make that deadline, so we will be opening our doors for first appointments on Sunday morning. But our phone numbers will be active as of 8:30 tomorrow for community members to call so that we can provide you with appointments. And those appointments, for the calls that we get tomorrow, we will reorient you to the Chateauguay drive-through testing site, which is in the parking lot of Anna Laberge. We have 75 spots kept for us for tomorrow if we need those spots to be able to reorient our community members to. So that you should call the testing site tomorrow morning if you need an appointment for testing, and the phone number is 450-638-3930. That's the regular hospital number. We have 2 extensions available to make appointments. So the first is 2296, and the second is 2275. So we'll be posting that a little bit later. It's really important to note that you will not be tested if you don't have an appointment. And to get an appointment, you need to call this number. And at this number, we will do a triage. We will triage your symptoms and make a decision based on the criteria whether you should be tested or not. The reason why we don't just randomly test everybody is because if we test you too soon, if you don't have symptoms, your test will be negative. And it's better to wait till you have symptoms to be able to get a true picture of whether you are positive for COVID-19. Perhaps Dr. Gauthier will be able to refer to that a little bit later. And so I'm going to give you a little bit more information about the testing center in general. So starting Sunday, our testing site will be open generally 8:30 to 4:30, 7 days a week. Again, you need an appointment to be able to be tested. It is a drive-through, so you will not be able to walk through, because the idea of the drive-through is that we offer protection to the nurses who are doing the testing. And therefore, if you do have symptoms, well, you will have symptoms if you're coming to be tested, you'll be in your car, and you need to have a window that is able to go up or down. Therefore, if you have a van and you're in the back seat, we will not be able to test you. Also, very important is that if you have symptoms, it means you're self-isolating. If you're self-isolating, you should not be in a car with people who don't have symptoms, because then you are no longer self-isolating. It is too close. Sorry, Lloyd's trying to give me a message, but I can't read that. Sorry. So if you're coming in the car, you need to be by yourself in the car to be tested if you have symptoms. Now, if you're a family of 2, 3, or 4, and you all have symptoms, and you've called and you all have appointments, you can come together in one car because you already all have symptoms. You're all being tested, and therefore we can have a maximum of 4 people in a car for testing. So I'm going to give you an example. If you're a mom who is over 70 and has been on her own, calls you and says that she's starting to develop symptoms of fever and a cough, you may help her by calling the phone number at Cattery and the extension to get an appointment, but she has to drive herself to the testing site. So this might cause a bit of issues for some people who don't drive or don't have a car. So we're going to be looking at other ways to mitigate this problem after the testing site is functional. It's very important to not call medical transport to bring you to the testing site. They will not be able to do that. We don't have enough resources to be able to bring everybody to the testing site. So you have to come in a car with a window that rolls up and down. So I'm going to just remind you of the symptoms that we're using at the triage center to determine whether someone should be tested or not. So the symptoms are fever and or cough and or respiratory symptoms and or loss of taste and or loss of smell. So those are the symptoms that are identified at this point for determination of testing or not. So I think that's the basics. So as of tomorrow morning, 8:30, if you have those symptoms and you want to be tested, and please, I urge you to call this number if you have those symptoms. The goal is to test as many people as possible because we want to test and then we want to contain the virus. And by the more we test and the more we know the results and understand what's happening better in our community, the more we can contain and make decisions that are appropriate for the community. So the idea is to call the hospital number 450-638-3930, and the extension is either 2296 or 2275, and we have some wonderful staff who are going to be taking your calls and then giving you appointments. So if they give you an appointment tomorrow, you'll be oriented to Chateauguay. After tomorrow, it will be here in Kahnawake at our site. So that's the information that I have for you today. I am really happy to present Dr. Annick Gautier. She's a family physician at KMHC, and she's also the medical advisor for the COVID-19 task force. We've accumulated a bunch of medical questions that we've been receiving over the last couple of weeks, and she's here to answer many of them. Thanks.
Thank you, Lisa. So my name's Dr. Annick Gautier. I generally don't call myself Dr. Annick Gautier, but sure. So my name's Dr. Gautier, and I want to first start off talking about a little bit about me. And you might be wondering, like, why does she want to brag? No. It's because fear, and that's what's going on right now. People are so afraid of COVID-19, of the symptoms, what's going to happen to them, their families, their children. But fear is fed by misinformation. So I want to help relieve your anxiety by getting correct information from the correct sources. So I felt I needed to talk about me so that you know who I am, so you can know that you can trust me to give you the right information. So I am a family physician at Zacharie for the last 6 months. I'm also a family physician at St. Mary's Hospital, and through that I'm an assistant professor at McGill. I am in charge of teaching residents, teaching medical students, as well as leading research at McGill. But that's actually a recent part of my career. Prior to that, for 15 years, I studied infectious diseases. So I have a PhD from University of British Columbia, where I studied E. coli, so no, not a virus, a bacteria. But then I switched my research focus to hepatitis C virus in New York City at Rockefeller, where I figured out how to grow the virus. And then I was brought back to Canada. I was headhunted to come back here and lead the hepatitis C programs for a company, a private company, to develop medications against hepatitis C. Through doing that, I then also worked on a bunch of other viruses. And it was doing that work that made me realize that I needed to go back to the medical and be a doctor and treat patients, so that one, because I love interacting with people and helping people one-on-one, but also because if I needed to make changes in the medical system, I couldn't do that as just a PhD, and I needed to be an MD PhD, so a doctor, also a scientist. So I hope with that you trust me a little bit to give you the information that I'm about to give you. So the first thing I want to give you in terms of information is where you should get. So I'm going to answer a bunch of questions that I have here, but I'm sure through Facebook right now people are writing in their questions on Facebook. I'm not reading it. I can't see a live feed of those questions, and I'm not going to be able to answer all of those. And honestly, you want me not to be spending all my day, because I could spend every hour, every minute of the day, every 24 hours writing back questions, because I've been getting questions across Kahnawake, but across my patients in Montreal and across the country. What you want me to do is you want me to spend time with Lisa, Westaway, Dr. Jones, the rest of the task force to advise them in medical issues and to help make sure that we're doing the best thing for both our inpatients and our outpatients and our entire community. So with this, I'm going to bring up my laptop. I know you're not going to be able to see things, but I'm going to explain what you're going to look for. So, viable, valid sources. So I want you to type in Quebec.ca into your browser. You're going to pull up this page with the blue and the Quebec.ca, and there's a yellow thing. In the yellow, it says Information sur le coronavirus. You're like, hey, but I don't speak French. That's no problem. You press this little button here at the top, you move to English. Sorry, I have to actually change it. I didn't log on to their Wi-Fi. Okay. Then you're going to get coronavirus disease in Quebec. And there's like lots of different information, including, look, situation Quebec. So if you click there, you get the epidemiology. So that means how many cases are currently in Quebec. You get the symptoms and the treatment. You get the measures taken by the government. You go in here, instructions and directives. It goes through health recommendations for everyone, what happens if you're returning from a trip, and so on. It gives you a self-care guide. So if you are diagnosed with COVID-19, but you're well enough to stay at home, what are the suggestions to do? That's all there. You keep going down. You got families and supported individuals. You get businesses and workers. You get over here, so I went too fast, other topics. In the families and supported individuals, there's lots of different groups, including information for pregnant women and coronavirus. If you click on that, you get to this page which describes some of the information and the recommendations. But that's actually going to lead me into my first question that I got, and I got a few questions, and I've tried to sort of paraphrase some of the questions because some of the questions were similar. So if you don't hear your exact words, please bear with me. So the question, hi to all. My question would be, as a pregnant woman and knowing of another community member who is pregnant and positive, what happens to our unborn babies? Are they safe? There hasn't been much info anywhere to look into the virus while being pregnant. Thank you, Task Force, for everything you're all doing for the community, and followed by a heart. I also want to thank you for putting that heart, because we are working so hard for you, and we really want to protect you. But we especially want to protect our moms and babies, because that's how society keeps going. So this is, again, where I'm going to talk about my background. So not only I'm a specialist in infectious disease, but what my research lab worked on in the last years was congenital infections. So viruses that are transmitted from mom to baby. I want to tell you, coronavirus is not one of those viruses, okay? So that's the most important thing to know right now. Now, on this particular COVID-19, or the real virus name, as a virologist I have to tell you, is SARS-CoV-2. So SARS coronavirus 2, because it looks like the old SARS that we had several years ago. So SARS-CoV-2, we don't have a whole lot of data. We have a good amount of data on SARS and MERS, as well as coronaviruses in general. But even the data we have on SARS-CoV-2 shows that pregnant women are no greater risk of getting COVID, okay? There's nothing that makes you, as a pregnant woman, have COVID more often. There is no transfer to the baby. So that's either through mom's blood into baby through the placenta. There's no transfer during birth through the amniotic fluid. There's no transfer through breast milk. Okay, so I hope those things are reassuring. Now, there is one thing. When you're pregnant, and I think, well, okay, half the people in the room are men, but when you're pregnant, your belly gets quite big, and that puts like your lungs in much smaller capacity. So it makes you more prone to get complications from infections. Just like a pregnant woman who gets influenza or the flu has a higher risk of getting pneumonia, a pregnant woman who does get COVID-19 has a higher risk of getting pneumonia. And that's what we want to avoid. And you know how we avoid that? We wash our hands. So I mentioned on the radio the other day, I don't know if other people heard it, but I think it deserves mentioning again, that coronavirus is surrounded by an envelope. And that envelope is super, because you know what kills that envelope? Soap, alcohol. That kills the envelope. So therefore, you can kill the virus. So the best thing for our pregnant ladies is for you to wash your hands. When you walk into a room, when you're changing places in the house, every time you think about it, that means you should wash your hands. Every time you eat, you wash your hands. But it's not just the pregnant lady that has to do everything, because the dad's going to be there and going to be the dad too eventually. So we need the dad. We need everyone in the entourage to be washing their hands. That is what I want to say about pregnancy. Next question. Epidemiology. Oh, they didn't ask the question epidemiology. I grouped your questions into sections. Younger people seem to be getting COVID more. I thought this was an older person's disease. Okay, this is again where I want to show you back to the internet. So if you Google, or just even type in Canada.ca, and you click through their website on COVID, because it's like literally the first thing. When you Canada.ca, you hit COVID-19, you get this. It's not as pretty as the Quebec website, I must point it out. But look, you go down, you can see across Canada what the rates are. You keep going down, you get the cases over time. You keep going down, I'm going to go back here, demographics. So this is age distribution. So you can see, and this is all going under 19, so that's only 5%. Now, when you go over, 30 to 39, that's 17%. So while people feel that the younger people are getting affected, it's really not at the rate that the older people. Now, it's important to note that what we are screening for and testing for in Canada is for people who have symptoms. So there's a difference between COVID disease and COVID infection, or coronavirus SARS-2 infection. So the people who are on this are all the people who have disease. And you can see that there is a peak. The 50 to 59-year-olds, they form like 20%, but you really have this amount. We do have, good. I'm happy that there's less people in the older age range. So down here is your greater than 80. There's only 5% of the population in Canada. I'm happy about that, because those are the people we really need to protect. Because while I said that there's no, as to the writer's question, no, there really isn't a preference for younger people. I think, one, we're testing more younger people, so you see, but we do know there's an age distribution in terms of severity of disease. So the older you are, the worse it is. And that's why we want our 70-year-olds and up to stay home alone. I know sometimes that's not possible. They need to have caregivers, but then those caregivers should not be going out of the house either. I know that's hard. That's not how life works. My parents are over 70. We have been calling them on the phone and FaceTiming them. That's where life is now. Okay. The next question was, how is it known that the virus wasn't in the community for a while? I've heard of people with flu-like symptoms in the community in the first week of March and all the way back to early January. Okay, so we can start with like January and early February and even into like late February. It wasn't COVID-19, and the reason we know that is because it was actually only in Wuhan, China at that point. It started in Wuhan, China, probably in the middle of December, and so at that point there wasn't actually global spread until the end of January, and that's when we actually started to see. And if you go again to the Canada website, there's links to the global data as well. So you can definitely see, and you see the spread going on. Now, in March, it is possible that some of those people that you saw with a flu, they could have had a flu. And I know because at that point we were still testing for people for flu, and I was getting some flu positives, and I was treating some of the community members for flu because they were flu positive. But then there could have been people with COVID, but at that point it was just starting and we didn't know. We weren't testing people, so we didn't know. Medications. People asked about some meds that they were taking, wanting to know. So I take medication for high blood pressure. It's called Ramipril. I don't make Ramipril. I don't make any money off of it. That was what the question was. I heard I should stop. Okay, so Ramipril, and now I'm a scientist, so I'm going to educate you a little bit about how things work. So that medication works by inhibiting or stopping an enzyme in our body called ACE. I'm not going to go through what it stands for, but what's interesting about it and why people are worried about ACE inhibitors like Ramipril is because the receptor, so what the virus binds to in the body, is called ACE2. It's the same protein. And so people initially were like, oh, well, actually, that means if you take an ACE inhibitor like Ramipril, you'll actually reduce infection. But the body works in weird ways, and well, ways that are predictable, and that when you inhibit something in one place, it actually produces more of in others. So that was why there was a theory that if you took ACE inhibitors, you might have an increased chance of getting COVID infection. However, that was all hand waving, and when you actually look at the data, there's no data to support that. So if you are taking an ACE inhibitor or an ARB, that's another class of antihypertensive, so anti-high blood pressure medication, you should stay on those medications, because we know that having better control of blood pressure and better control of all of your diseases, you do better off with COVID as well as other infections and other processes. So if you become COVID positive, keep taking your medications and talk to your doctor. And I mentioned the talk to your doctor is that we are open at KMHC for phone consults. Occasional situations, we will definitely see you in person, but most of the time, we have all our physicians there, that they are there on their usual days of the week for pretty much most part, and answering your questions. The next question is about ibuprofen, or some people call Advil or Motrin. So I've seen reports online that people should not take Advil as it enhances COVID-19, that Tylenol is good to use. Is there any professional or scientific claim to this? Okay, so that's why I mentioned it after the whole ACE inhibitor, is because ibuprofen or Advil also increases the expression of that same receptor for the virus called ACE2. However, when you again look at all the data, when you're COVID negative or we're in the middle of testing, we actually leave you on your usual ASA, so you take your little baby aspirin for your heart disease, stay on it. If you have known back pain or whatever, you stay on your medications. However, if you become COVID positive, while there's no great evidence that it worsens COVID-19 disease progression, we are generally recommending you to stop your Advil, and we're treating symptoms with acetaminophen instead. But that's for people who are COVID positive. Respiratory diseases. Someone I love has asthma, which is not completely under control. Should they get tested? So I think this is two different questions, but should I get tested? If the asthmatic person doesn't have an increase in their symptoms, then they shouldn't get tested. Now, if they do have an increase in symptoms, they're not themselves, they're having more difficulty breathing, and even if they take their Ventolin, it's not really helping, they're having to take more, then that is actually one of the criteria for getting testing. So then, yes, I would call the number and arrange for testing. Now, the worry is that people with respiratory issues, because they already are weakened respiratory-wise, they'll be worse off if they get COVID-19. And that sort of is the case, but not quite. If your disease is quite well controlled, so we know that asthmatics that are well controlled should continue taking their regular medications, including steroids. And so if you take a steroid puffer, like it's an orange puffer, you keep taking that as your doctor recommended, okay? Symptoms. I wanted to just go over. So fever, cough, respiratory difficulties are the main symptoms, but there are some other symptoms that come out, and I know it's all a new thing, and every day and every week we're getting more data and more information, and unfortunately that's how we are right now. But actually the fact that we are doing this in the time of the internet, the time of open sourcing, the time of open research, there is huge numbers of publications coming out daily from Chinese, from South Korea, from people in Canada that are collaborating with people, from people in the US collaborating with people. So that's amazing. So we're getting all this information. So at the moment, those are the symptoms that we really classically define, but there are other things like gastrointestinal difficulties, anosmia, which means the lack of smell that's sudden, not like if you've never smelled for the last 20 years, that's not COVID, okay? That's from other reasons, probably smoking. So stop smoking. Okay, can I bring about smoking? It wasn't a question anyone asked me. I was very disappointed, so I'm bringing it up myself. So I was really hoping that smoking would just make COVID worse, because that would be my anchor to get people to stop smoking. Because I have done, if you're my patient, you know that I talk about smoking all the time, and not to continue smoking, to stop it. And one of the things, though, about smoking is when you look at the data in China, it really didn't pan out. It didn't actually look that people who smoked did worse. However, in China, an interesting finding is that women did better with COVID-19 than men. And epidemiologically, pretty much all men in China smoke. I'm making some generalizations, but most men smoke, and a lot fewer women smoke. And that is actually thought to be the cause. So if you've been thinking about stopping smoking, today's your day. My next questions. I've read about countries implementing taking your temperature multiple times per day, like up to 3 times, even if you're asymptomatic. Is that something we should consider doing? It gives ownership to the family to be monitoring. And we need ownership on this fight. And I totally agree with the ownership, and that's where I think getting the data and getting the information from the right sources and the easy-to-read things, that's the best thing. And those are going to Quebec.ca, Canada.ca. We have a lot of those links through the Kahnawake 911, Facebook group, KMHC. So use those resources that are directing you to viable resources. So if you like to watch the news, and down south, because I know a lot of you watch U.S. Television stations, there's a man with blondish hair that's a comb over, sort of orange in the face. So that man, behind him, usually over here behind him, is a guy with white hair. And if you stay on, keep watching, after the man with the leaves, the white-haired guy comes over. His name is Anthony Fauci, or Dr. Fauci. I actually was very lucky to actually have known with him and worked with him when I was in New York. He is he's a doctor, he's a specialist in infectious disease, and he's a virologist. What he says is correct. Unfortunately, he may be fired because he's saying things that are correct, but I'm not going to go into the politics of that now. But what I'm trying to say is go to the right sources. So the next question is, my colleague wrote a story today about Indigenous peoples making their own face masks. I have seen it done by some crafters here as well. Are these helpful, effective, or problematic? So I think the creativity part of it and doing something with your hands that's not just watching the news, I think that's great. But I think the issue is that we know, and there's very nice evidence, that cotton masks don't do anything, and they actually could potentially make things worse. Because if people don't wash their hands, that's the biggest problem. And when people put a mask on, it gives them a false sense of security that they are safe. When people put gloves on, and even put gloves and then put the Purell on their gloves, no. When I put on a pair of gloves at work, and the cameraman is actually my patient, so he actually probably have seen me do this, and he can testify to this, I wash my hands first with, I actually, because of the way it's arranged in the hospital, I have to open the door, grab the pump, shut it with my hip, and then I wash my hands. Then I put on the gloves. That's good hand hygiene. So the problem with the mask and making fabric masks, the fabric masks don't help prevent anything, and you actually touch your face more and therefore auto-inoculate or auto-contaminate yourself. So I would not recommend making masks. There are people in the community that are thinking about making scrubs for the people in the hospital. I think there's a project going on about that. I think that's a great idea. So I encourage those things. If you want to make the mask just because it's fun and your kids can do something, I think that's great. I had a lovely patients who do beautiful beading work. So if you've never done that, I know you can't see your elders, but maybe through like FaceTime or something, they could teach you how to do that. I think that would be great. Being creative and getting your mind active is going to help not cure COVID, but at least help with COVID anxiety. I'm almost done. I know I'm going on forever. I was told that although I'm on day 12 of my quarantine, because my daughter goes to work every day, that I'm not on quarantine. We live together, practicing distancing and sanitizing everything and taking all precautions, but we do live together in the same house. Okay, so there's one thing that I want to correct is, and it's nomenclature, so wording, and as we mentioned earlier, we've learned a lot of new words over this 2 weeks. So quarantine, and that's like the Quarantine Act that we discussed at the beginning, is a legal definition of actually not being allowed to do something, not being allowed to leave your house. Whereas self-isolation is more that it's volunteering, you're not seeing anyone else. But really self-isolation is not really, you're staying in your own room. So it's not just being social distancing, which is the 2 meters apart, so basically 2 arm lengths apart. So yes, unfortunately, I agree with public health, if that's who told you. If you have been with your daughter who's been going to work and you're not actually in a separate area of the house, in your own room, then you've been doing social distancing from your loved one, but not self-isolating from them. I finished my 2-week complete self-isolation, no symptoms, and would like to know if it's safe for me to go to the post office, bank, and maybe the store in town. And this has multiple sections. So I'm going to say it depends on your age. Because if you're over 70, no, I want you to stay home. Because I don't want you to get it. I don't want to have to treat you. Not because I don't want to be a doctor. Of course I want to be a doctor. I just know that I have a better outcome if you stay home and you stay safe. Now, if you were younger than 70, then yes, you can go out, but again, it's practice social distancing. When you get to the bank, you're going to have to touch their door to open it. Hopefully they have some dispenser there, so you would take some to wash your hands. You would arrange things with the bank. You would take the money, which has also been touched by like 1 billion people. Okay, maybe not 1 billion, but a lot of people. Then you take the money, and then you put it wherever you're going to put it, and then you leave the bank. On the way out, you're going to wash your hands. Then you touch your door handle again. Then you get into the car. Then you get home, you touch your door handle. On the outside, by the way, it's probably the dirtiest part of your house is the outside door handle and all the door handles, so wash them. People don't think about that. And then really go to the sink, wash your hands. Do you notice that I wear shirts like this, I think, and you're my patient, you know this, eh? All my shirts are 3/4 length. Do you know why? So I can wash my hands up to there all the time. All right, so that's what I would say. Now, the next question is, my daughter has been getting me groceries and leaving them on a porch. Oh, so then when I read that part of the question, I realized, oh, this person probably is over 70. So then the next question is, my family, including 3 grandchildren, have also self-isolated, and no one has any signs of the virus. Are we able to get together in my home? And my answer is no. I know that hurts. I know that's hard, but the answer is no, because even if the kids especially had no symptoms, we don't know if they actually were infected. Kids can actually have very, very few symptoms, if at all. So that's why it's actually better to keep them away from their grandparents. So that's why if you have access to FaceTime or other things, please use those means instead. If you don't have access and you can just use the phone, please do that. The last point that I wanted to talk about, actually there's two things, sorry, 2 things left. Testing. So I want to talk about the testing process so that you're not shocked. So it's a swab. It looks like a Q-tip that the nurse would take and put it in the back of your nose. But it's not like putting some Salinex in your nose. You're going all the way back to the nasopharynx and the oropharynx. It's going to burn. It's like putting wasabi up your nose. Okay? So I just want everyone to understand that. But if you get that wasabi feeling, that means they took a good sample. It's all the way back there. Then they put it back in the liquid. That liquid gets stored on ice, then goes to the lab. The lab has to extract the RNA, because it's a virus is an RNA. It's not a pea on the stick assay. This doesn't take 2 minutes. This takes at least 3 hours, if not longer, because of supplies in Canada. It takes several days to get your result back. Every single person will get a call with the result. So everyone will get a call if they're COVID-19 negative or COVID-19 positive. I know this because I am going to be getting, and it's confidentiality, and I'm a doctor. I see all sorts of things every day that's my job, and no one else will know this. I will get a copy of all of your results so that we can make sure that everything is followed up on. So this is incredibly serious process. Just like every result we get, we follow up on. This one's even more. Often it's, and you'll agree with me, if you have a negative result, I generally don't call you, but often I'll arrange to come back later and we'll have a discussion about it. But this case, it's we call you. If it's negative, we call you if it's positive, and the nurse on the phone will give you information of what to do. Now, my last question is, are pets in danger of catching COVID-19? If so, what measures can pet owners take to protect their pets? I just want to mention that I'm not a veterinarian. I'm a medical doctor. I do know about coronaviruses, though, so I can tell you that there are coronaviruses that infect dogs, but COVID-19 is not one of them. So that was not the pathway of transmission. So no, your dog is not going to bring you coronavirus or give you coronavirus. So especially for our elders, if they have pets and everything, I'm happy for them to stay. However, I know our pets, and I love this about the community. I think it's super cool that the dogs roam around. You are laughing in the room at the moment, but if you're an outsider and you come in, it's the coolest thing ever. But anyway, so all these dogs are roaming around. But maybe if you're an elder, I would not suggest having your dog roam around loose. I would prefer them to stay close to you. And often dogs and cats, but dogs more, know that if their loved one is sick or something's going on, so they might be showing more anxiety. I know my dog at home, because it's home with my 2 children that I leave alone all day because I'm here in the community. It's okay. Don't call DPG on me. So they're old enough. They're old enough. The dog is confused. So your pets, you will not get coronavirus or COVID-19 in particular, but they definitely need some love, just like we all need love. So I appreciate your time. I know I talked forever. I got comments the other day that I'm too much, but I wanted to give you this. But the most thing is that get yourself informed, go to the right resources, and we're gonna get this. We got this. Thanks.
Well, thank you very much, Dr. Gautier. I can tell you I haven't ever learned that much in 20 minutes in my life. I guess I've been learning from the wrong doctor. Dr. Utker is not the guy I should be listening. Anyway, listen, we hope that this helped. I know it helped us in the room. That was some great information. This was an initiative that actually was announced yesterday. Questions had been coming, but we're glad we did this yesterday to get people to call and question. Go to questions@mck.ca and it'll get there. Also check the KMHC website. We have, of course, covid-19.kmhc.ca. That's one of the portals that we've been using here. And of course, you've been watching this on, not YouTube, but Facebook, Kahnawake 911. And you've probably been listening to K1037 to get the live feed as well. So if you didn't see it now, you can see it on Paul's cable later on. But once again, thanks to our presenters today. We'd like to thank you for taking the time to join us. We will be back tomorrow, roughly the same time. We'll be here both on Saturday and Sunday, hopefully with good news. Again, the huge news in Kahnawake. There's been actually quite a bit this week. The testing center, the testing site will be in operation this weekend, probably on Sunday. And of course, also the announcement this week that the MCK, along with David Dunizakta, have put together that $9 million aid package for people here. There are so many people who, small businesses or people who are not collecting employment insurance, they need that help. And that was done this week. So from the people in this room, we wish everybody a safe weekend. Take care of yourselves, take care of your whole family, take care of yourselves, and have yourselves a good weekend.